individual also needs no introduction. Is Dr. Eric Plasker. And I still remember meeting Eric many, many years ago. And somebody had sent me an audio tape of a lecture that Eric did and said, you got to get this guy to come speak to the students at Parker, maybe even get him to speak at Parker seminars. And I was hooked with this guy because his passion, you're going to experience one of the most passionate individuals in chiropractic, but also somebody that's really dedicated his life to really the service of not only the family practice, which has been his business, but also the 100-year lifestyle. And he also wants to make sure that you understand that right now the need for what we do every single day has never been greater. So let's give it up for Dr. Eric Plasker.
Good afternoon.
Good afternoon.
Good afternoon.
Good afternoon.
Wow, how many people do you know that could start a letter to the editor with the word dude? Damn, that rocked. Hey, FCA, thank you for bringing us together for this reunion of friends and comrades going to battle. And you know what's exciting? So many of us sharing this panel together for decades, thinking that maybe we'd get tired, that maybe, just maybe, we would get worn out, that, oh, it's time to just pack it in, when the reality of it is, come on, we've worked our whole life for this time in history. We really have. We have worked our whole life for this time in history. We live in a world where we have a longevity crisis. If you will climb to 30,000 feet with me for a second and look down on the world and see what is happening in this crazy, insane world that we live in, that you will realize that we have a longevity crisis. We have people that are living longer than ever, longer than science would have ever predicted they could live, to the point where literally 100-year-old people are the world's fastest growing group. And none of them plan to live this long. None of them, they got there by accident. They didn't have a grand master plan. It is an innate, God-given birthright that our potential from the moment of conception, that blueprint, from the moment of conception, Jen, you're a beautiful little baby, from the moment of conception, has that blueprint to live to 80, 90, 100 years and beyond. Fab talked about beginning with the end in mind. That, well, if we're going to live, if we have learned, if our generation has learned that we have a longevity potential of 80, 90, 100 years and beyond, then how would we live our lives differently than the current generation of 100-year-old people, where most of them have not lived for decades? Most of them have not lived. They have been deteriorating and rotting away for decades. You think about our families, our parents, our great-grandparents, our great-great-grandparents. We watch them, many of them, suffer, not because of their innate potential, their innate intelligence, what they're capable of, the possibility of their function. That's not why they're deteriorating. They're deteriorating because of the choices that they've made and the lifestyle that they've lived, and the leadership that in many ways, as Dan said, you know, cholesterol, the statins are a hoax. The ethical, the unethical leadership, fudging numbers, giving misinformation, and then by the billions and trillions, feeding it to our parents and grandparents, making them feel like it's the right thing, when it is not the right thing. Our distinguished colleagues have said here many times that, yes, we have a healthcare crisis, which I believe, my colleagues, my brothers, my sisters, I believe that it is our greatest opportunity, this healthcare crisis, for unethical leadership and misinformation and misguided care has created the greatest healthcare opportunity in the history of the chiropractic profession. We have worked, all of us, our forefathers, so many people that were mentioned here that come from all over. Dr. Kelly, my friend, when he came to Life West and got to be a part of it out there, and my friends from Life and the other colleges that are here, and the other organizations and companies that have supported organizations like FCA and supported our profession for decades, waiting for this opportunity, waiting for us to wake up, waiting for the principle that we have, that we share, to take the lead without compromise. Think about this for a minute, and I'm going to ask you a question. Please answer. Raise your hand If you are under chiropractic care, raise your hand. Just out of curiosity, raise your hand high. Raise your hand high. Okay, I have another question for you. How many of you have been checked by a chiropractor at least once in the last year? Raise your hand. Okay, great. How many of you have been checked by a chiropractor at least once in the last 6 months? Raise your hand if you've been checked. Look around the room. Look around the room. It's all of you. How many of you have been checked by a chiropractor at least once in the last 3 months? Raise your hand. Great, thank you. Once in the last month? Raise your hand. Any once every 2 weekers? Raise your hand. Any once a weekers you overutilizers you? Yeah, right? So watch. You think about this. How many of you are also doing that for your family? And how many of you will continue to do that for yourself and your family at least over the next decade, 2 decades, for the rest of your life? Raise your hand if you will do that. We have an ethical responsibility to, as my father used to say so eloquently, he used to say when we were younger, you know what, Eric, you know what, to all of his children, you have to practice what you preach. Here's the thing, chiropractors, my brothers, sisters, colleagues, friends, we need to start preaching what we practice. We need to start preaching what we practice and make it relevant in every single thing that we do. So that we speak to people's core values. Bam, bam, consistently, constantly. You know, Fad mentioned that. I wrote The 100-Year Lifestyle, an international best-selling book. It's not about just getting 100-year-old people under care. We must think about it differently, this opportunity. Think about this. The children, the grandchildren, the great-grandchildren of this generation of seniors is suffering because they're seeing they're looking at their seniors and they're saying, oh my gosh, and they may not be thinking of it in this way, using these words, but they're on some level, unconsciously, innately, it's like this. Oh my gosh, I have those genes, but I don't want to be like that. If I get like that, shoot me. Or, better yet, show me a leader. Show me a leader. Give me a leader. Someone to follow. Someone that's different. You know, for a lot of us as chiropractors, we wonder, well, why, if that's all true, and if everything that we're saying is so true, then why aren't they just lining up for care? And the answer is, they will just line up for care if we start teaching and preaching what we practice. Listen, this is profound. Your practice is a reflection of what you teach. If you want to change your practice, change what you teach. Your practice is a reflection of what you teach. If you want to change your practice, change what you teach. How about this? Our profession is a reflection of what we have been teaching for the last few decades. If we want to change our profession, we need to change what we teach. And we need to teach and preach what we practice. If I said to you, if I passed a law, and I said, hey, you know what? Listen, chiropractic is now illegal. How many of you would join the Underground Chiropractic Adjustment Once a Week Club of America? Raise your hand if you would do that. Yeah, we would. So it's time to start preaching what we practice and on a global level, teaching people out in the world how and why to participate and utilize chiropractic care as a priority, as a gatekeeper, throughout our entire lifetime. I think about my father, who had a heart attack when he was 49 years old. Scared the life out of him. The doctor personally rushed him to the hospital. As they were driving to the hospital, my dad pulled out a cigarette and started to light it up. He was overweight. The doctor, thank God, ethically pulled over, looked at my dad, and screamed at him and said, "Are you crazy, Alan? Are you crazy? You just crumbled the cigarettes up and stopped smoking. And then he started running. He started to change his life. He started running, and he started taking statin drugs, Dan, because that's what the doctor told him to do. He bought into the hoax. And you know, he ran for the next decade and a half. Not because he wanted to enjoy the wind in his face, or to set a record, or to perform at a high level, or to even enjoy the outdoors. He ran to not die. And he died about 5 years ago, 78 years old. Never knowing, with a healthy heart, and not knowing his children and his grandchildren for us, took away his brain. Come on, we have an ethical responsibility, chiropractors. We do. It's our time. Listen, we are the favorites. People say to me, Plasker, how could you say that? You've been saying that for years. We're the favorites. Come on, we're so used to being the underdog, we wouldn't know what being the favorite looks like if they kissed us on the mouth. Why do you think they're always attacking us? If we were irrelevant, they'd leave us alone. But we got to stand up with this truth and go to work telling this truth in a way that reaches the people. It is our time. Everybody say, I'm credible. One more time, I'm credible. One more time, I'm credible. We are credible. And we got a lot of work to do. We got a lot of work to do to get to the people. You know, it's interesting. As I travel around and I talk to chiropractors and I think about all the things we have gone through over the last 5, 6, 7, 10 years, a decade or so or more, and I think about how we have organized ourselves as individuals with all of this healthcare reform and repackaging and systematizing ourselves to get paid from third parties, and third parties, insurance companies, so that we can have these crisis care patients, these people that are injured in accidents, sports injuries, and all these things, so we can get paid in that area. And we've invested tens of thousands of dollars, some of us hundreds of thousands of dollars, some of us that haven't done it properly, $1 million or more, all on the crisis care side of what we do. We have an ethical and moral responsibility to organize ourselves now that most of us have completed that. We have an ethical and moral responsibility to organize ourselves around lifetime patients, lifetime care, systematizing lifetime patients so that they can participate the way that you and I do. You know, over 30 years in practice, this is like the 30-year plus club up here now. 30 years in practice, more passionate than ever. Over the years, thinking about file number 4, John Floyd, still under care. Started chiropractic care when he was in his mid-20s, weightlifting, hurt his back, came in, got educated, taught him about it. We taught him about the importance of a healthy nervous system over the course of their entire lifetime. And guess what? He decided, he chose, because he was educated, he said, I'm going to make this a part of my lifestyle. If I may live to 100 years or beyond, 89, 100 years and beyond, hell, grandma's 87, I'll at least make it that long. I want them to be good ones. I don't want to rot away. And guess what? File number 4, still under care 30 years later. Still lifting weights 30 years later. Participating in chiropractic care for 30 plus years. Now at mid-50s. He's performing at his highest level ever. Still under care. You know what? He's utilizing chiropractic care the way that you and I do. He's doing it. He's paying for it out of pocket. You know, the people that we organize around that are just the crisis care people, and we should ethically and morally, if we're going to be in that game, we should do it ethically and morally and dot the I's and cross the T's. And because he chose to stay involved with the care, the crisis care piece, like many of your patients that are just coming in because they had an injury, maybe their value in your practice dollar-wise is $2,500, $3,500, or maybe a little bit more, or maybe much more than that. The lifetime patient value of this one person in a practice over 30 years, he must have spent $60,000 over 30 years. And it's the right thing to do. That's the most important piece of this. It's the right thing to do. He's still under care. You think about the babies in our practices that we see today. And you know, for many of us, we study pediatrics. We don't talk about the ethics and the importance of being under chiropractic care, having a healthy spine and nervous system throughout your entire lifetime. And these babies, we turn our 12-visit low back pain practices into 6-visit ear infection practices. And these kids, they grow up, and watch, these inactive patients, which maybe some of you have at least 1 or 2 or 3 inactive files in your practice. I haven't counted them, but I know there's at least 3. These people are going out into the world after you help them. Listen to this. They like you, most of them. They like you. You help them. They're saying good things about you, and we put them out in the world to deteriorate with less pain. Come on, we got a job to do. And I'll tell you something else that's also really important. We, like many of my colleagues up here, working very hard for 30 years. I'm so honored to be and share this platform with you, tirelessly working behind the scenes. The reason why this is so important in this crazy world that we live in, we're in an election year. We're here at the National, FCA sponsored. And we have an election coming up. And the thing about the people that are lifetime patients versus inactive files, the lifetime patients are much more likely to vote our way. I can promise you, the inactive files, the inactive patients, they will not vote your way. They will not vote our way. They feel better, they're back in the world, they watch the drug ads, they vote the other way. Come on, if we want to cause social change, get those inactive files back into your practice, change the conversation inside your practice, because lifetime patients equal votes. Lifetime patients equal votes. If we want to be relevant, socially relevant, and cause change, we've got to preach what we practice, deliver excellent quality care in the same way that you would get it for yourself or your family, and at least, come on, at least offer it up as an option. You know, what is the ethics of being able to make that recommendation? It is absolutely ethical. It's not ethical to bill insurance for all that lifestyle care. But these people will pay. They will pay. Like John, $50,000, $60,000 over 30 years. Because he values it for himself and for his family. Come on, we got a job to do. We have a job to do. Come on, it's time to stop being a victim of the times and recognize that in this healthcare crisis, that we all, you know, we glorify the people that can talk about the crisis. Wow, they really laid it out for us. Come on, I'm laying out an opportunity for you. We live in a world where people are living longer than ever, and they're not living with quality. They are rotting away and deteriorating because they didn't know they were going to live this long, so they didn't know how to take care of themselves to ensure quality of life as they age. And because you're all getting adjusted, and you're all utilizing the care, it's in you, your philosophy, it's in you. You do it for yourself. It's time to shift your thinking and systematize what you do also for lifetime patients. You know, I'm really excited that FCA has chosen the people that they have to bring this conversation to our profession. It's an important conversation for you, It's an important conversation for all of us as doctors, and most importantly, for the people in your community that are in desperate need of new healthcare leadership. It is important for them. You know, I look in the eyes. I have a great honor at Life University. I give the Friday night speech in front of all the prospective students and their families. I've done it at Life West too, creating chiropractors. I look at these kids' eyes and their parents' eyes, and they are hungry for leadership. They are hungry for you being your best you. Preach what you practice. Thank you so much.